Good afternoon, everyone. It's my second talk today. Is everyone able to hear me? Great. So it gives me great pleasure to talk about the RRS-HA long-lasting and give also real-life data, real-life results in how we can treat our patients, and in particular, how we can use the 7-point injection technique to vary slightly from the protocols, and also when we personalize the treatments. A few of you have come to me from the audience while I was at the SkinTech stand asking for questions about potential complications, what we should worry about. Now, one of the things is this product, RRS-HA long-lasting, was made in Spain, predominantly a Caucasian country, not too far from here. However, we are in North Africa. We're on the border with the Middle East, and our facial features are slightly different when it comes to our Caucasian counterparts. And it is this what I'm going to emphasize today. And we will start with some real-life data when it comes to the actual RRS-HA long-lasting. So you can see it is a monophasic. It's cross-linked with hyaluronic acid, 7 milligrams per mil, and it's coming with a protective buffer of approximately amino acids. They act both on the hyaluronic acid itself, and they also act with the surrounding skin pretty much immediately. So when we carry out treatments, we see an immediate 3D modeling effect. Okay, I've been told that I need the microphone. Sorry about the couple of minutes there. You're able to hear me with this microphone? Oh, okay. So I'll continue, and I'll let the gentlemen do what they're supposed to do. So we have a monophasic gel, which is BDDE cross-linked. It comes in the 3 ml syringe package, and we are going to use this in our study. So our first study focuses on the actual face. So we've got 12 doctors from 5 different countries and 43 participants in them, age range 26 to 54. And then we have a protocol, which is the 7 injection protocol, which those of you who are using RRS-HA long-lasting will already know about, and then 2 further visits when it comes to day 7 and day 30. Indication or inclusion within the criteria is signs of photoaging, 2 to 3 in terms of severity grading, wrinkles, as well as dermal atrophy. So within this research itself, you've got Fitzpatrick 2, 3, and 4, most of the patients being in Fitzpatrick 3, and again, a wide variety of age ranging from 35 to 75 years old. Again, focusing on the inclusion criteria, because this is the reason why we carry out RRS-HA long-lasting treatments to our patients, because we need to see signs of dullness, sallowness, poor radiance, poor shine in the skin, uneven pigmentation, fine lines, coarse lines, as well as poor laxity and poor elasticity. So these are the visible topographical and mechanical signs that we use to assess clinically when it comes to our patients, when it comes to the treatments. There are a number of validated scales which we used. You'll know the Glow-Go scale, and there's the wrinkle severity reduction scale, and the mid-face volume deficit scale. All of these are used in conjunction, and we're going to show you the results in real-life data, as well as clinical examination, where your clinicians have taken part to look at texture, discoloration, skin atrophy, and skin condition generally. So you will all know of the 7-point injection technique, where we're dividing the face horizontally and vertically, and we're drawing around the muscles orbitalis oculi and orbicularis oris. And where these lines intersect are exactly where our injection points are. We are injecting intradermally 0.2 mils per injection point, basically 1.5 mils per side. And I will show you this in our live demo, which we'll do very shortly with our patient prepared. And we'll also discuss again the differences, how we stray away slightly from the protocol when we personalize the treatments, especially in North Africa, Middle East, and Asia. So, looking at the results, we have a 32% improvement in skin texture by day 30, and you can see that increase from day 7 and being maintained all the way into day 30 itself. There is a 25% case of skin turgor improvement. Again, you can see by day 7 there's a jump, and then that is further maintained by day 30. And looking at one of the other validated scales, the mid-face volume improvement, we have a significant improvement by day 7, and then that jumps up to 16% improvement by day 30. In terms of the wrinkle severity reduction scale, we have a decrease of 8%, and then a further improvement by day 30 to an improvement of 13%. Another main thing that we know our RSHA long-lasting does is give immediate and intense skin hydration. So when we are looking at our patient, when we are wanting to know what sort of patient to actually use this product on, skin hydration is the main thing, where we see the crepiness, fine lines, sunken skin, and you can see here from the results, by day 14, a significant jump, and then that is maintained by day 28. We also want to know how physicians themselves feel about the treatments. So on the left side is what the physicians feel in terms of the global aesthetic improvement scale, and on the right hand side you can see how the patients feel. And by day 30 you can see 91% of physicians felt there was a general improvement in their patient's skin, and that's correlated by 88% on the right hand side by day 30, where patients also feel that there is an improvement in their skin. And this is quite important because we have quite demanding patients. Patients want results yesterday, not even today. So where we see patient satisfaction correlates with physician satisfaction, that's a very big yes to using this treatment, and why it will work with your patients, and why they will also come back for further treatment and further enhancement as their trust in you increases. So we didn't want to leave it just there. This is, after all, a regenerative medicine conference as well as an aesthetic conference. So this is where our skin builder actually fits in very nicely in the regenerative medicine side. We used ultrasounds here, and you can see after 2 weeks and after 4 weeks, as we go towards the right, you can see the thickness of the dermis begin to change, the amount of collagen becoming more oriented and more denser in the dermis, and therefore you can see why we call it a skin builder. Similarly, the results are emulated in another patient. You can see the mid-face volume starting to improve, skin texture also starting to improve, but also ultrasound evidence is also showing you that the dermis is also thickening slowly up to even 4 weeks and beyond.
You have 5 minutes for presentation. 5 minutes left. You have 5 minutes left for presentation.
Why did we test? Well, one of the things is we know that we can see macroscopically that there are changes happening in the face. to the skin. We also wanted to see microscopically what else is going on underneath in the skin and how that reflects on what we are seeing. So all of these results are starting to reflect everything we see externally, but also internally. I hope that answers your question. And you can see again further emulation and replication of our data, where again we're seeing quite significant improvement in skin texture, as well as that being correlated in ultrasound examination and results. So we also wanted to see how the skin on the hands also changes. So we had 60 cases in 9 different countries with 13 doctors involved. And you can see here from this video how we are marking out from a point in between the distal radius and ulna into the grooves in between the metacarpals themselves. And these lines are used as a guide for which we use a cannula to carry out our superficial injections. So you can see a small bolus of lidocaine, 2%, 0.1 ml is perfectly fine. And this is injected straight into the area where we are going to insert our cannula. Usually we are fine doing and using a 22G cannula with a 21G introducer needle. And again, I will show you this technique today. So you insert quite smoothly and go gently along the line, using it as a guide within the groove itself. A 50mm cannula in length is perfectly reasonable to use. And you will see gently the skin start to lift up pretty much immediately. And once the injections themselves are carried out and we finish the product, usually we would use 1.5 mils on each hand. Sometimes, depending on the severity of crepiness and dehydration, we could even go up to using 1 mil per side. And once we carry out the treatment, a gentle massage is all that is needed. And we would ask the patient in terms of aftercare to carry out massage every night for 2 to 3 minutes before going to sleep, and they do that for around a week. There can be some tension sometimes, as long as you're nice and gentle. Some people have superficial veins as well, and you will find that as you gently push your cannula, it just moves gently out the way. And again, you use the same technique for more distally. And again, lidocaine, and we use a cannula once again. And we can go straight into the finger itself. And in post-treatment, anti-inflammatory cream is perfectly reasonable to use. If you use the SkinTech products, we are using Actilift, and you can see quite immediate changes there in terms of hydration. So looking at the results themselves, we also have a hand wrinkle grading scale as well, going all the way from 0 to 4, and you can see an improvement, a jump from day 0 to day 7, and that is further maintained to a 38% improvement by day 30. Again, skin hydration as well as radiance. The above line looks at hydration, and you can see a significant immediate improvement, and then that is further maintained both in skin hydration and radiance. Skin laxity again, significant jump by day 7, and it's further maintained by day 30.
You have 15 minutes more, Mr. Javed, for live demonstration.
Why did we?
15 minutes for live demonstration.
Yeah.
Maybe you have
We're
to
just
pass
about
to...
finished, yeah.
Okay.
The patient is prepared.
Okay, thank you.
And we did a general aesthetic improvement scale, and we saw 100% of physicians felt positively in terms of the patient improvement, and 90% of patients correlated that data. In terms of local application effects, there were no adverse events reported, but only some people felt that there was some pain and erythema, some residual edema, but nothing long-term or long-standing. And you can see some immediate results. And you can see improvement in skin hydration, skin turgor by day 30. Again, this is correlated in ultrasound scans where you can see the thickness of the dermis starting to improve. So you can see RRS-HA long-lasting is a very good product depending on the patient selection, where we are using a monophasic gel, BDDE cross-linked, and it's associated with improvement in skin photoaging, restoring mid-face volume, and also skin hydration and turgor and elasticity. A research paper has been published. It was published in IMCAS just in January in Paris. You can use the QR code there. And again, I've come back to this slide here because I'm going to go next and carry out the live treatment. Thank you very much.